and welcome to the Herb Room at Pacific College of Oriental Medicine. So we're here to explain how the herb room works, basically. So how it starts is you have the granules and you have the raw herbs, and these are the granules. These are separated into these are all alphabetical order, so they go from A to Z, and everything goes in alphabetical order. It's not separated into categories. The raw herbs, on the other hand, are separated into categories. So all the different color coding implies that it does something different. So one will disperse wind, one will clear heat, things like that. So you have to, so when you're looking for them, you have to make sure that you're looking in the correct area. Otherwise, you're not going to have access to the herbs that you're looking for. They're not in alphabetical order from A to Z. So once you have established where your herbs are and you've gotten them, that's when you come over to the table and you put all your herbs out. You want to make sure that you're putting them face up when you're just collecting them, and when you're done with them, you want to put them face down. And so that's sort of the universal symbol for putting herbs away. So this is what the granule box looks like. This is inside their granules, which means that it's an herb that's been mixed with something, with a binding agent. And so what you do is you measure it on here. So you pour the granules into here. 6 is a common measurement that you'll find here, and then once you have that amount, you pour it into that. So you weigh it here, and you weigh each granule package here, and then you dump it into the funnel, and it collects at the bottom here. So when you're done, you move the funnel into here so that you make sure that there's no spillage, and then you put a label on it, and you make sure that your intern and your supervisor will sign off on whatever you've done. So that's how you do granules. How you do the raw herbs is a little bit different. So you want to collect your raw herbs. So again, each of these are color coded for what they do. And so once you collect them, you're going to weigh them in a different container. If you have to grind them up, which isn't always done, but is done if it's specified, then you're going to use this guy, mortar and pestle. And then you're going to put them in here. You're going to use about this much paper, and there's a special way of folding it so that the herbs don't fall out. So then you don't need to use tape or anything. It just folds into its own little package, and you give that to your patient, and they pay, and it's done. So after every herb shift, you want to make sure that all these counters are cleaned up, because a lot of especially the granules can get pretty messy. So underneath you have little brushes and these things so that you're able to sweep it up and throw it away. You also want to make sure that the shelves underneath don't get too messy, because again, the granules do tend to get dust everywhere, and some of the raw herbs that we're using are also like dried leaves and things, so they have a tendency to just shatter and go everywhere. So you want to make sure all of the surfaces that you're cleaning, that you're working with, are cleaned at the end of your shift. So you also want to make sure that a supervisor comes in at the end of your shift and checks out what you've done and okays it and makes sure it's good. So after everything, you always want to make sure that your supervisor and your intern are comfortable with what you've done, because you'll be assisting them with their formulas at this point. So once you have your sheet signed by your supervisor, then you're good.
So you want to hand to the office worker your herb sheet that's been signed by your supervisor. They will keep the white copy to ring you up and put in your file. You take the yellow copy to fill the formula and to keep for your own records. If the formula is for a friend or family, the clinic office will shred the white copy with your request. It's best to have a supervisor sign off and you fill your formula on your shift if possible. If not, try to come during times when there will be less traffic in the herb room, such as the beginning of a shift. If you sign in at the office to make a formula and you don't have an herb sheet signed, the clinic worker will inform a supervisor, and they will come out to the waiting room at their first convenience. Students who are not on shift are not allowed in the conference room. It is the supervisor's job to guide the interns who are seeing patients and not diagnose students who don't have appointments. The general dispensary policies, the first one is to keep the herb room clean. Our patients can see through the glass door. Students using granules should replace bottles in an organized manner as possible to keep the rows straight and professional looking. After making your formula, the grinder, mortar, and all the work surface equipment should be in the same state you found them in. Items should be returned to their proper place after use. Second, plastic gloves should be used when handling raw herbs, whether making a formula or restocking herb jars. Third, notify the clinic office or write a note on the marker board if we are out of supplies. Fourth, take advantage of the student on herb room duty if you need help with formulas or cleanup. The herb room hours are posted and enforced. Any work on formulas should be completed approximately 30 minutes before the end of the shift, and no formulas should be started within that time. This gives the herb room attendant time to clean the dispensary for the next shift. It's not fair to make the herb room attendant wait until the very end to start their duties or to have to do them twice, as it's ultimately the responsibility for the state of the dispensary. If there are interns who are consistently running behind and having to rush through formulas at the last minute, it is a time management problem that needs to be addressed, and the intern supervisor will be notified.
Thank you for watching our video explaining the herb room.